There are no metastatic lesions, but there are local nodes involved.
There's partial encasement of the superior mesenteric artery.
That puts it past the point where we can cure with local resection.
We could do Whipple surgery.
That's not advised for stage 3 pancreatic cancer.
Not quite. It's not advised for stage 4. For stage 3, it's discretionary.
In my discretion, he's better off with 12 semi-comfortable months rather than running the risk of dying on the table tomorrow.
If he doesn't die on the table, he could have many years.
It isn't our call to make. I'll talk to Paul, advise him of the parameters. Let him make his own decision.
No. Shaun should do it.
Claire can do it.
Yes, she can, which is why you should do it. This is a teaching hospital. Andrews is right. Being a surgeon isn't just about cutting.
Would it be okay if we spoke someplace more quiet?
You need someplace quiet to tell me I have acid reflux?
I think we should be someplace quiet because people sometimes get very upset when they find out they probably only have less than a year to live.
Okay, can I call my family? They should probably hear what you have to say, too.
I'd rather just talk.
Of course you can.
I'll elevate it with a 6-inch ambler tissue hook. You separate the underlying tissue with iris forceps.
I got it. It's anatomy scissors.
I think we're actually a little ahead of schedule. Might be able to get her home in time to do her homework.
Back to the bosom of her loving family.
We'd remove as much of the cancer as possible by removing the head of the pancreas and other attached organs, but then we'd have to reconstruct the anatomy. The easiest way to do that is to bring up a loop of jejunum.
Shaun.
Sorry. The jejunum is part of the small intestine between the duodenum and ileum.
It's a complicated, very dangerous surgery. And even if it's successful, post-operative complications are frequent and serious. And recovery can be very painful.
But if it works, he's better. He'll be healthy.
He would still need chemotherapy and a lifetime of monitoring, but hopefully a long lifetime.
Let's do it, Dad. What do you say?
What should I do?
It's your decision. All we can do is present you with the facts.
Yeah, here are the facts. Dad, the surgery may kill you. Not doing the surgery will kill you.
Can you give us a few minutes?
Of course.
It was very nice of Dr. Andrews to give you an office even though you're on medical leave.
Yeah, he is a prince.
Who's your surgeon going to be?
I haven't decided yet.
You should definitely go with Dr. Joshua Atkinson at Stanford Medical Center. His mortality index is 0.3.
It's too low.
Not enough of his patients are dying?
No, Shaun, sometimes patients die. Doesn't matter how good the doctor is, but when your mortality rate is as low as Atkinson's, it means you're turning away patients. You turn away patients, it means you lack confidence. You lack confidence. I don't want you inside my head. And I'd like to be able to dress myself when I'm all done. Shaun, what are you doing here? You showed up at work early this morning. Go home, get some rest.
I won't rest if I go home.
The surgery went great. Once everything's healed, I think you'll be very happy with the results.
Time is it?
Not quite 5:45. We just need you to pee and...
I need to go home.
And you will very soon.
Dad, it hurts.
I told you it would. We did a lot of cutting and scraping. You had a lot of scar tissue.
It hurts a lot.
We'll give you some Tylenol, and you can tell your mother you're cramping.
Oh, ow!
Pain ketamine, 130 micrograms per kilogram per hour.
Why does it hurt this much?
I don't know. They're not going home.
No!
She's heavily sedated. What did we do to her?
What if this is good news?
I know you haven't been a doctor all that long, but pain is rarely a sign of good news.
It is if you're talking about a part of the body you thought was dead. What if this means there's still viable nerve endings in there? What if this means we can actually reconstruct her clitoris and that it's capable of sensation?
Maybe. All we know for sure is she's not going to be home anywhere near 6, which means we're about to have a missing child on our hands. You have to bring Andrews up to speed.
I did a bad job of telling you that you're dying.
Is there a good way?
I can't figure out when I'm supposed to lie, when I'm supposed to tell part of the truth. And it doesn't really matter because I can't figure out how to do it anyway.
You did fine with me. You never need to lie. Lies don't protect you from the truth.
I don't like your haircut.
Okay. Maybe sometimes when the truth can't help someone, we should definitely just lie.
Do you think praying will help you reach a decision?
I've already reached a decision. I'm praying to help me find comfort with that decision. My family wants the surgery.
And what do you want?
I want what my family wants. I love them.
But they love you too, right? Don't they want what you want?
Long ago, I made a decision to be there for them. No matter what. And if the last choice I make in my life is consistent with that, I'm comfortable with that.
I'm surprised by you.
I arguably made errors in judgment, but it was all in an effort to help a patient.
Yes, and that would make sense if you thought you'd never have another patient ever again. And if there wasn't currently an opening for chief of surgery.
I didn't know that was on the table.
See, that's the difference between you and Melendez. I have no doubt that as soon as I got this promotion, Melendez had done the math and reacted accordingly. But I suspect that even if you had done the math, it wouldn't have changed how you handled this patient.
I don't view that as a weakness.
I'll handle the administrative fallout. You notify the parents immediately.
I can't. We don't know the girl's real name, and we have to keep her sedated, so there's no way we can track.
She's a teenager. She's got a phone. Next time it rings, answer it.
Feel the mesenteric artery pulsing?
Yes.
You shouldn't. You're too close to the vein. Great. Dr. Brown, pass the Penrose drain through. Bobby? Suction.
Not at all.
I see leaking pancreatic fluid.
I don't need holes in everything it touches. Our duct tie didn't hold.
Suction, needle driver.
Excellent. You have approved a scrub nurse and a circulating nurse and 7 other personnel. Everyone and everything is covered except for an actual surgeon.
Yeah, I think we may have to postpone.
Have you notified your tumor to stop growing in the interim?
I think any possible damage from a delay may be more than offset by having somebody competent digging around in my brain.
Competent. What's wrong with Sanders?
6% mortality rate.
Taylor.
I don't like the way he's planning on dealing with a carotid tear.
That's nowhere near your tumor.
It's the principal.
Unger.
He doesn't like me.
No one likes you.
No, you don't like me. He doesn't like me. That's 2.
Just pick a name. I don't care who. I don't care if they're a doctor. Just pick a name. Because in 48 hours, you're either getting your surgery or you're getting a new oncologist.